Next up, I'd like to introduce to you Carrie Chanter. She's the manager of co-occurring services integration, and she will cover the suicide and crisis prevention focus area.
Good evening, everybody. As David mentioned, I am going to go ahead and cover focus area number 4. And I think it's important for our listeners to understand that suicide is the 10th leading cause of death in Michigan. And actually, in the last 10 years, our rate of suicide in Michigan has increased by about 30%. So that's quite alarming. For Genesee County, we have on average of about 50 people die each year by suicide. So something to keep in mind. And unfortunately, most national experts, just like Dan had said in the beginning, are really predicting an elevated suicide rate as a result of the COVID-19 pandemic throughout our nation. So GHS definitely has been involved with suicide prevention efforts in Flint and Genesee County over the years. In fact, we just launched a suicide prevention campaign this week called Let's Talk. It's the Let's Talk campaign, and it also, part of that project is also offering evidence-based training in the community. So residents in Genesee County will start to see various outdoor billboard messages, TV and radio commercials, as long as a freshened up website for suicide prevention. We're really excited about that. Also part of this project, we had over 500 GHS staff trained with a suicide prevention evidence-based training called Living Works. And we also were able to offer 500 licenses for the rest of this year for other community members and important stakeholders that we know are important for suicide prevention in our community. The real goal here is to try to prevent suicide and create a network of safety in our community. So I think a lot of people will start seeing that media campaign out and about. GHS has also, though, provided mental health first aid training, QPR, which is another evidence-based suicide prevention training module, and different crisis de-escalation courses to our community members and providers. We've also offered the My Strength application to our entire community, which is basically assists individuals with anxious or depressive thoughts, substance use, insomnia, or other mental health or mood-related needs. So we've been able to offer that. And then lastly, we have been able to offer a series of faith-based outreach programs for suicide prevention in the Flint community. And while we're pretty proud of those efforts, we know it's not enough. And unfortunately, with the alarming rise in suicide across our state, GHS must respond with a more comprehensive suicide prevention plan. Unfortunately, there's not a lot of funding to do that. So if the millage were to pass, this would help support those efforts. And the state of Michigan actually just released within the last week or so a Michigan Suicide Prevention Commission report. And in that report, it identified 5 priorities that we really need to focus on statewide to focus on. So if the millage passes, GHS will start first by mobilizing partners in the community to develop a suicide prevention plan, which is greatly needed. And the work of GHS will be based upon those 5 statewide commission priorities that were outlined in the report just released. And those 5 priorities would focus around minimizing the risk for suicidal behavior by promoting safe environments, resiliency, and connectedness. The second priority is increasing and expanding access to care to support those that are at risk of suicide, improving suicide prevention training and education, implementing best practices in suicide prevention for healthcare systems, and also enhancing our ability to collect suicide-specific data. So those will be our 5 priority areas if this millage passes. Thanks.
Thank you, Carrie. Appreciate that. Next up, let me introduce Elizabeth Birch. She's the Director of Children's Services, Outreach Prevention, and Low Intensity, and she will be covering focus area number 5 of how we integrate with the K-12 community here in Genesee County. Elizabeth?
Thank you. Hi, everyone. My name is Elizabeth Birch. I'm going to talk to you today about focus area number 5. You know, as we've said earlier, the COVID-19 pandemic has obviously had a great impact on all of us, and mental health and substance abuse has definitely been an area that has been significantly impacted. There's multiple studies that have just shown the increase in emergency room utilization for children who are experiencing psychiatric issues. And we know that this is not something that is going to go away, or just, we're all going to just go back to normal. So, while we do our best to really provide programming for kids, we definitely know that there are gaps in the mental health system. One area we've been really committed to improving is our prevention services for children in the community. And that, of course, means working very closely with our local community schools, as well as the ISDs, to provide support to staff as well as students. We have several grants that have allowed us to begin to providing some of these services, and I'll talk a little bit about that. But there's definitely more that could be done, and the millage would help to support that. What we are currently doing when it comes to prevention services for the K-12 community, we do offer mental health first aid training, which is exactly what it sounds like. It's a first aid training that addresses mental health. It's meant for individuals in the community, but it's also a beneficial course for even those of us who are in the mental health field. That is something that we've been offering for a number of years to the community, and we've trained quite a bit of people, including school personnel. We also have a grant with the state of Michigan that allows for us to provide infant and early childhood consultation, which means that we have a specialized staff person who is able to provide consultation and training to daycares and early childhood centers, as well as provide individual consultation and assessment for individual children who might be struggling. And that is a really amazing program, and we're really excited to see growth in that area. We also have our mobile mental health unit, which is very unique and interesting. We're very grateful that we have this resource. This was born out of the response to the Flint water crisis, and it does allow us to provide some mental health supports in the school as well as in the community. However, it is primarily focused on children who were impacted by the Flint water crisis. We also have a very dedicated outreach team that was also born out of the response to the Flint water crisis, and they're really focused on helping to really get the word out about our services and help get individuals in the community connected to what they need and deserve. This millage could really help us in a lot of ways, including having an increased presence within the schools. That's something that many schools wish that they had, is a liaison or someone to really help them with understanding signs and symptoms, and also help with actually getting children's services to help with their mental health needs. We know that there's a lot more that we can be doing. There's a lot of really great evidence-based practices out there. Unfortunately, we're so limited currently with our ability to provide many of these just because of eligibility criteria. So we're proud of the work that we're being done, but we know that there's so much more to do. Thank you.
Thank you, Elizabeth. Appreciate that update. Next, let me bring back Jennifer McCarty, the Director of Clinical Services, who's going to cover focus area number 6, the Crisis Center and Crisis Stabilization. Jennifer.
Hello again, everyone. So to tie things back together, we talked about a lot of different focus areas, but this one in particular really kind of catches a lot of crisis services here. So Genesee County right now does not currently have a place outside of an emergency department available for people experiencing urgent or emergent mental health needs. Local emergency departments do their absolute best to manage these patients. However, they do not have staff available with the expertise to treat people in acute crisis or with urgent mental health needs. and they are really limited in space, especially with the pandemic, with emergency medical issues, of course, taking the priority. And they know that they don't have the staff that have the expertise to treat these patients. So they're just trying to really kind of band-aid the situation until someone can be transferred elsewhere and receive the actual treatment that they need. So pre-pandemic, GHS was discussing a partnership with Hurley for a physical location to provide these types of services. In the picture here, you'll see the building located on 5th Ave, just west of Grand Traverse, not far from Hurley Medical Center Hospital campus. And we were in the planning stages. And when the pandemic placed these efforts on hold, it was mainly because both the priority of funds and staff really went to that pandemic response. So traditional funding sources do not fully fund the creation of a physical space that would house a crisis center and the staffing needed to provide these kinds of services safely to all comers in the community. What we don't want to do is we don't want to have a facility that can only see a small sliver of people who need our help. We would like to see anyone and everyone that needs any sort of mental health treatment if they're having an urgent or an emergent need. So it's our goal to create a space where anyone in Genesee County can come with those urgent or emergent behavioral health needs to receive care, and also to be connected with ongoing care at the level that's most appropriate, like a psychiatric hospital if that's necessary. So millage funds would allow for a physical location to be established that can accept all comers regardless of their insurance coverage or lack thereof, meets the needs of persons experiencing those needs, anyone in Genesee County. So staff would be available 24/7, 365 days a year to provide assessment, treatment, and crisis stabilization with a goal to try to resolve the immediate issues at hand, or if necessary, during an interim period of time until someone can be connected to a more intensive level of care. So one thing to draw your attention back to from when I talked earlier about focus area 1 and focus area 2 is to connect those first 2 focus areas that I spoke about. And so that if that person with urgent mental health needs to interact with law enforcement, then law enforcement would have a safe space to bring that person to come and receive treatment from mental health professionals in a timely manner, where they're not waiting a substantial portion of time in an emergency room waiting room, as medical issues might take a priority. And so they could come and receive that treatment versus those long waits. Now, we would also want to make sure that we have providers that specialize in behavioral health treatment. And really the ultimate goal is we don't want people who have a mental health need to have to go to an emergency department when they don't need to, just because there's no other option. So this crisis center would really allow for a kind of to tie all those services together and provide a place where people can receive treatment, hopefully in our community, at the lowest level of care possible.
Thank you, Jennifer. And before we get to the last slide on the focus areas, if anybody has a question, please post it in the Q&A box. And one of my colleagues on the call tonight as a panelist will be more than happy to answer that, either about the millage specifically or about Genesee Health System itself.